everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System. Welcome to another edition of Insights. Today, we welcome with us Olivia Chapman. Thank you for being with us. We appreciate that. Yeah. Today, we're going to talk a little bit, hopefully you're okay with this, wellness issues, okay?
Yeah.
More specifically, weight management issues. But before we do that, do you want to tell us a little bit about yourself? Your degree, where you went to school, that kind of thing?
I am one of the family nurse practitioners here at Orange City Area Health System, and I had my bachelor's degree at Dordt College and got my master's degree at Clarkson College in Omaha.
Okay.
During my time of working towards my degree, I was working as a nurse and actually worked in the diabetes education program here. So this kind of sparked my interest in diabetes care, and after becoming a nurse practitioner, I sat for a second board exam and now am board certified in advanced diabetes management. So it's really just allowed me more opportunities to help patients manage diabetes.
So you see a lot of folks, though, right, in family practice, and you have a passion for that as well. Patients of all ages, all kinds of health and medical needs, clearly. And by the way, you're very well liked and very well respected, so we really appreciate you being on our team. But you do have a passion for weight loss. And sometimes that kind of goes hand in glove with diabetes a little bit as well.
Yeah.
So can you talk about that a little bit?
Yeah, so working with so many patients with diabetes, I've learned that the resounding issue I hear time and time again is with weight.
Okay.
And even when we're looking towards people who don't yet have diabetes, this is an issue we see with pre-diabetes, with insulin resistance, with so many patients. And I've really found a niche of helping people with it before it becomes an issue like diabetes. So if I can work myself out of a job in the diabetes world by helping people, this would be just absolutely wonderful. And learning so much about medications, this has been helpful to just understand how these work and how we can prevent diabetes. So
what are the kinds of things that you start people on, or a path that you go down when they first come in and talk to you about being overweight?
So, right away, I want to understand this person's life. I want to know what is their normal schedule, how can we fit small changes into their daily life? Can we make some dietary changes? Can we make some activity changes? How can I link them with resources we have in our health system? So I'm looking to include some physical therapy if there's some pain issues that are inhibiting them with getting active, looking to include the dietitian if there's small changes or big changes we can overhaul with their diet. I've also found our behavioral health team to be just imperative.
Excellent.
For most people who have some weight issues. There's a lot that's wrapped into weight and how we feel about ourselves, and our behavioral health team is fabulous helping sort those out.
And quite frankly, sometimes I need to hear that, okay, Marty, it's not that complicated. Okay, calories in, calories burned. So at some level there's a fundamental base, but many times it goes well beyond that. So it's just me that needs to get hit over the head with a sledgehammer once in a while. Now, across the course of time, people say, well, I just want to take a pill for this. I just want to take a pill to feel better. I just want to take a pill to jump higher. I just want to take a pill to lose weight. All right. Now, unfortunately or fortunately, science sometimes accommodates that, right? And so let's talk a little bit about weight loss medication.
Yeah.
Maybe we stumbled into that a little bit with diabetes management, and you can talk about that. But tell us about that. If I want to come in and take a pill, what are you going to tell me?
Unfortunately, there's still no magic bullet.
Okay.
There's not one pill that's going to meet every person's need.
Okay.
But there are things that can help with specific areas that maybe are deficit. So maybe this is a person who does have some pre-diabetes or some insulin resistance. There are things we can do. There's medications that can help fill those gaps. As we learn more about weight loss, we want to make it as easy as activity and diet, but hormones. We as people, our bodies are so complex, and learning that there might be medications to sort out some imbalances there. Unfortunately, insurance is a real hurdle with some of these medications. So I usually take the individual person. We talk about our goals. We set realistic goals. We don't want everybody to be the weight they were in high school. Our bodies aren't supposed to be. We're supposed to grow and change over time.
Sure.
And finding the right place for that person's body to be is really important. So finding medications that fit in with their goals and that don't lead to further complications down the road.
So there really isn't one size fits all. And sometimes the benefit of a diabetic approach or medicine is some weight loss. But again, you take a good thing and too much of it, you make a bad thing out of it. So I get that and appreciate that. So another thing is that, you used to be in the diabetic education role directly.
Yeah.
You're not anymore. But could you talk to us about the role D-Meredith plays and how that kind of fits into family practice and your role specifically?
Yeah, so Dee is the current diabetes educator, and she and we work together on so many patients. We often find that with a person with diabetes, I'm setting the plan in place and she's on the ground, hands and feet, helping that person through day to day. So we get this great plan for them and she's following up. How's this working for you? Do we need to adjust something? If we need to adjust it, we meet together as a team and say, what can we adjust? Same with patients with insulin pumps or continuous glucose monitors. I'll be the one who starts that process with them. She works through the bugs with them, and then they come back to me and we adjust settings. So she and I are just a lovely pair. I hope she never retires.
Yeah, I agree. Yeah, there are some cool things out there right now for those glucose monitors, for example.
Yep.
Not pricking your finger. Those kinds of things are really life-changing kinds of things, and we as a team here can help people approach that and solve those solutions.
Yeah.
So as we wrap up, what kind of advice might you give people who struggle with weight?
Yeah, I think the first piece of advice would be find small things to change every day. Don't shoot for those large goals right away of I want to be active 5 days a week, I want to lose 50 pounds.
50 pounds.
Maybe you start with something small like I'm going to stop drinking soda and start with some small tangible goal.
But coffee? Can I include coffee?
Black coffee, sure can, yeah.
Okay, sorry to interrupt you.
But starting small and then building on those successes. Don't set up a plan that you're going to fail. And if you're struggling, come in, see me, see Dee. If there's some underlying diabetes issues, we would love to assess your current medicines and say, oh, these are some weight positive medicines. Can we find ones that maybe lead towards weight loss or don't cause more weight gain?
I see, okay.
And I also encourage people to remember that there is not one perfect body size that everyone needs to be. Health can come in many different shapes and sizes. Good.
Any final thoughts that you might have, anything else that you would like to share with us today regarding weight loss, diabetic management? You're there for people to come talk to if they want.
I'd love it.
Come hang out in the clinic. And how do you get a hold of you?
Yeah, calling and scheduling an appointment, an established care appointment. We can do a well visit, whatever people desire. We can even just do weight management.
That's 737-2000. Right? All right. Well, thank you for joining us today. I really appreciate that. And on behalf of all of our patients, thank you for being part of our team.
Thank you.
Thanks. All right, everyone. Thanks again for joining us for this edition of Insights.